What in particular would make you a good doctor?
G'day, how you doing? Alright, one particular thing. I'm only allowed to say one, right?
You can say whatever it is that you think would make you a good doctor.
Sure. Okay. So, to pick like one really particular thing about myself, I would say just like my overall personality and demeanor. I think I have a tendency to put people at ease, and I'm very easygoing, even whether it's like the first interaction or 10 years into a friendship. I think I can quickly get to a point with someone that we can have a good chat about pretty much anything. I think it's particularly been exercised in my experiences at the nursing home. You know, got like everywhere from 60 to 90-year-olds all have different life experiences. All don't know who that like young chap is that's like walking in and trying to have a chat with them. And so whether it's like making them a cup of tea or helping them with their bingo or like wheeling them in their wheelchair, it's taken a lot of practice to just like strike up great conversations and really entertain people. But it comes naturally in my demeanor, and I think it's something that's very unique to me, where some people find it like they'll be a bit more rigid about it potentially, whereas I feel pretty comfortable with most people just, you know, being open both directions, telling people about my life in an open way, which obviously in medicine I can't, you know, launch into stories and be like constantly, you know, trying to be funny and other things, but I still think the core ability to pretty much chat with anyone is a particular skill that I have developed over my years that will translate well as a doctor. If I have time, some other things that I can say about myself is that I think I'm quite analytical. I make good decisions, which is something that I think is very important as a doctor. But one important thing is I try to consider all the information before I make a good decision. I think a lot of people in medicine will like kind of become books of flashcards walking around, memorize a lot of things and try and like kind of pattern recognize or like just say the right thing at the right time. But if I'm not sure about something, I'll tell someone that. But I'll go about finding the information, being a little bit more introverted about my decision making, and ultimately trying to make the best decision for everyone. And I think because I've been a teacher for a long time, I have a good ability to involve patients in that decision making, explain the processes that are happening, explain why it's difficult for me to make a decision, whether it's reading an ECG or prescribing a different medication. I spend the time explaining to the patient why it's difficult for me to make that choice, teaching them the basic physiology so they appreciate that.
Sure.
Because then they don't think I'm incompetent, they just think that I'm trying to make the best decision for them. So I think those are some of the things about me that will make me a great doctor.